Morning, my name is Joe Hattersley. I'm a extended care paramedic working for Wellington Free Ambulance. I've been kindly asked by Belinda here to give you a tour. This one is of 434, and the nice thing about doing a tour of the ambulance is that with our frontline vehicles at Wellington Free, everything is pretty much standardised, so it means that no matter which vehicle you jump into, everything should be exactly the same, which makes it a lot easier as a student when you're first starting out, knowing where things are located. We're going to start off and just have a look at through the cupboards on the side, and I'm just going to give you a quick rundown as to what's in each cupboard. So we're going to start at the far end, at the feet end, and this is our first aid. Most of you will use it for the first aid, so you've got some gauze, bandages, triangular bandages, your glad wrap, saline, ice as well. Most important on the top left is your vomit bowls. You always want to know where your vomit bowls are at as well. And you've got some spare life pack consumables as well, so your paper, ECG dots as well. Moving along, so to the middle area, you've got your fluid in the upper corners, which you'll soon learn about in the following years as well. You've got your water bottles and your cups, and just obviously make a cost saving, we pour the water out of the bottles and into cups for patients, because there's generally no need for them to have an entire water bottle each time as well. And we also carry pain relief, so paracetamol elixir and methoxyflurane, which is a inhaled analgesia, which you'll learn about later on as well. Now sometimes people will put this in this cupboard, other times it should remain in its bag. So there is some subtle differences as but they should be fairly standard. Towards the head end, we're getting towards the airway, so these cupboards are equipped for that. So we've got at the bottom of these cupboards we have our adult resus, our adult oxygen masks, and our adult nebulizer masks as well. And you'll go over that shortly as to what each mask is used for as well. And above that we've got the pediatric. And on the right side again we've got consumables for our suction unit, and we've got what's called a CPAP. Again, that's a bit later on. Now this is obviously a lot of information to take in as well. The nice thing with this is that we have a laminated sticker on each of the cupboards, and it basically gives you an outline as to what should be in each cupboard as well. On the other side, passenger side, again more cupboards. So we have our personal protective equipment, also known as PPE, and as you go through the service you'll hear a lot about the acronyms as well. So things like bird flu, I'm just trying to think of other times that we've had to wear these as well. Quite rare, but from time to time you will need to know where it is. And face masks, not only for yourself, but also for the patient as well, particularly with droplet issues. Cleaning, you've got wet wipes and a few chemicals as well to clean down your stretcher, clean down your equipment, particularly after maybe a diarrhea or vomit. Unfortunately, you're going to get to grips with that is. In these cupboards, we've got our towels. We have our transfer belt, which you'll learn about during your manual handling course. We have a pedimate, which will be opened up to you shortly, and this is a car seat basically for infants to be used during transport. We also have a transwarmer, and this is like a giant heat pad for newborn babies. Two other things as well, we have a stretcher cover as well, particularly on the downpours, and a canvas sling. Now this is used rarely, but it's quite an effective extrication device where the patient is put in the middle, and then there's grab holds on either side that allow for the patient to be carried. Particularly useful in small corridors in a home where you might have to bend a patient around a corner. where the carriage chair is unable to go in. Next we're going to move along to the IV cabinet, and this is just a very brief overview as to what we've got. We'll start at the bottom, so we've got our bins. We have our biohazard bins, so that's where we're talking about sort of blood products or items that need to be destroyed, hence the yellow bag. And in the bottom, just a general waste bag as well, where it's cheaper for us to dispose of it in a normal bin. Your bottom drawer contains your ECG electrodes, your posiflushes for IVs, again you'll learn about this later, and some commonly used medications as well, and there's some consumables for blood sugars and things like that. Your bottom drawer, your second drawer from the top contains your IVs, and there's also a safe with a key for the top drawer, and that's where the restricted items are kept, such as morphine, fentanyl, the pain relief medications. We're going to move on now to a little bit of the pieces of equipment in the ambulance as well. So at the very back we have our green carriage chair, and that's belted in at all times for safety. And just unclipping the belt, you should be able to lift it out quite easily through this gap as well. It's best to do it quite slow. If you tend to do it sort of quite fast, it gets stuck and then you kind of panic. So my advice to you is that if you're asked to get it, just take your time and unclipping the belts, making sure that there's nothing attached to it, and it should come out quite nice and easily. Our life pack, you're going to be using this all the time, and this is secured in with a bracket, and there's a sort of pull handle just at the top, and you just basically then are able to lift it, and it's sitting on a foot stand as well. And again, you just got to be quite careful in lifting this out, so supporting it from the bottom and from the top, and a bit of a wiggle, and you can lift it out. Now it's put on here for monitoring of your patient during transport, and the nice thing about it is that we're able to release it and we're able to move it around. And at times during a journey, the paramedics may need it in this position, so that someone's seated on the side of the patient and so a paramedic at the head end of the patient are both able to see the screen as well. Now at the head end, we're going to look at the suction unit, and with this one here, again it's lifting this yellow lever, and you want to have a hand on the suction unit as well, because there is a chance for it to fall out if you don't hold on to it, and lifting it up and it will come right out. Now you may want to practice this as you'll be sat in this seat during your placements, and you may be asked to get the suction unit during an arrest or other case as well. At the bottom we have our medical air, and again you'll go over that a little bit later on. And we have a little cupboard here where it houses the batteries for the life packs. And again, just putting your finger in, pushing against the clasp, you're able to release it quite easily. From the towards the sort of front of the ambulance,